said, they can only do so many spinal taps before they might pinch a nerve or hurt something.
Or you become paralyzed.
Or you become paralyzed. And they said the other option is to see this neurosurgeon and get an Ommaya reservoir put in. And, I was really kind of like hesitant and freaked out about that because I didn't know what that entailed. But when I went and I saw the neurosurgeon,
right.
and I met with him, and, he told me how dangerous the procedure was.
What did he say?
He said the way that they put it in is they have to cut open your skull and drill a hole into your head.
Ugh.
And then they have to blindly put this
blindly?
Yeah, because they can't see where they're going, obviously.
Wonderful.
And they have to put this Ommaya reservoir in here, and then there's a catheter that goes and runs down in between my brains
into
my spinal fluid and into my spinal column. And so the only thing that they had that was showing them where to go were my brain scans, my MRI scans.
Okay.
And they said that there was a very, very small space between my brain and my skull for them to get it in there. So, he obviously told me about all the different things that could have happened. I could have lost like part of my memory or any other part of my brain or whatever. Yeah. All kinds of stuff. And, the thing that I asked him was, I said, what would you do? Because
you asked the doctor that. What would you do?
Yeah, I said, you have kids. If your daughter had to get this surgery done, and his daughter was only like 5 or 6, I said, what would you do? And he goes, I would have her do it.
Oh, so that's how you
like
decided.
No questions asked. And so I said, okay, let's do it then. I'm fine with that.
Wow.
And so I did it. But you know what? It's the best thing I could have done, because now I still have it, even though the doctors want to take it out. But you can leave it in your head for 30 years.
Okay.
No problem. So why not?
So there's no pain with that or anything, and
it's really fun.
So now you're well again, and maybe you could explain when you say remission. I don't quite, as a psychologist, a layman, a human being, I don't understand what that means. Remission. My guess is it means the cancer is gone.
Well, when they're doing different cancers have different tests for that. For instance, you just had your first PSA.
And explain to the audience what a PSA is.
PSA is specifically for prostates. The P stands for prostate, the S for specific, and the A for antigen. In Rachel's case, they did blood work, and they looked at, and maybe they did bone marrow or something. There are different ways in each country. Sometimes they do scans, but it's a combination of things. And so her blood was looking good, because
so there's no cancer
her leukemia
cells. They can actually see
cancer of the blood.
Okay.
And so when they look at them, the number is reduced, or hopefully not there. That's
so in my case, because I have to go back in a month or 2 months, they can actually do tests to see if the cancer is all gone for me.
Yeah,
too.
they judge by in that case, and then they even have an ultrasensitive PSA.
So Rachel, they went back and they said you're in remission, and how did that make you feel? What was the psychological?
You've been there once.
I had already been there once before, so obviously I was excited when I attained remission. But then the doctor told me that in order to keep the cancer from coming back again, because of my aggressive form of leukemia,
which
and
is
because
very
it came back so fast,
right.
They said that I had to get a stem cell transplant. And so I would have to go through this entire experience of, collecting my own stem cells and doing all the testing.
How do you collect
prior
your
to
own
that.
stem
It's
cells?
the coolest thing ever. It's the coolest thing ever, and I love talking about it. They gave me a Hickman catheter, which is a catheter in my chest.
Okay.
And they gave me a drug called Neupogen, which is made by Amgen. And what they do is I would give myself shots every single day, 3 times a day, of this Neupogen. Mom, of course, my mother wouldn't give it to me because I hated needles, and she was like, no way, you're going to do it yourself. And what the Neupogen does is it makes your body produce a really large amount of white cells.
Okay.
And when it gets up extremely high, it starts producing baby stem cells. And when you have all these baby stem cells in your body, they hook you up to a machine that's a lot like a dialysis machine, and the process is called apheresis. And through this, this IV I had in my chest, they were pulling the blood out, filtering it through this system, and putting the the stem cells up in this bag and filtering the blood back in.
Okay,
and so that was like a 4-hour process for up to 10 days.
Wow.
It only took me 4 to get 5 million stem cells. And then they freeze them. And that's how they got my stem cells. But you can only use your own stem cells once.
One time. I did not know that.
And then if the cancer returns and they have to do another transplant, you have to get a donor.
Okay.
And obviously there's more problems with that. But when they froze my stem cells, then they gave me 2 extremely heavy rounds of chemotherapy, which are meant to knock out your immune system. And then they gave me 11 sessions of total body radiation.
Whoa.
And the only thing that was protecting any part of my body were these 2 little metal blocks that were covering part of my lungs.
And that's a horrible thing, the chemotherapy, right? And then because I had the radiation.
Yeah.
And that I still am having side effects from that. And you had full body chemo and radiation.
Yeah. But you know what it is. I mean, you have to look at it on the other side. Like, I'm still alive, so I can't really say anything. And even though the chemo and the radiation have caused more problems for me now.
Like what kind of problems, if you don't mind telling everybody?
I have deterioration and degenerative disc disease in my back. And I have dental damage.
Dental damage.
And all kinds of stuff. I mean, early menopause, infertility. There's a lot more brain damage. I have a lot of brain damage.
You seem very smart to me.
Yeah, but I've been talking about cancer for like 3 years.
Okay.
4 years. So I'm used to talking about it.
Okay.
And that's why, let's move on and tell the audience what you started doing about your speaking, about your jewelry, about your fundraising. All, you're moving on. Right. You're in remission, and what are you going to do with your life?
And let me set the scene for a minute, because this is a special individual right here. We really want to listen to her laugh. I want to set the scene for a minute. She went through all this horrible stuff, all this pain, and she went through it with absolute laughter and just really a great philosophy about dealing with it and all that. Then you decided, I need to give back.
Yeah.
I need to give back. Say again?
Pay it forward.
She calls it
pay it forward. So now look into the camera and just explain how all these ideas came to you and how you went into complete service for your fellow cancer human beings. It's a great story.
Okay, so the reality was, when I was diagnosed, we weren't given a lot of resources or information as far as how we would get help. How I was going to get to and from the hospital and my house, because that's like a 2-hour drive. Or how I was going to get back into the gym to be able to lose the weight that I gained from the chemo and the steroids they had me on. I mean, there was a multitude of different resources that we needed that we weren't really given when I was diagnosed with cancer, which it should never be like that. You should never be kind of like lost and confused and unsure of what you're supposed to do. And so, I started out just speaking anywhere that I could talk about my cancer experience, high schools and colleges and organizations and all kinds of stuff. And I got to a point where talking about it wasn't enough, and I had to do more than that. And so I started this organization. It's called UCAN, which is United Cancer Advocacy Action Network, and we are a 501c3. And we provide resources and gifts of hope, which are just like this fabulous bracelet that Mary is wearing. And I incorporated all my love of like music and art into this organization. So I make jewelry, I make handmade plaques in memory of and in support of patients. We do a multitude of things that are amazing. But the real thing that we want to do in the future is we want to be able to provide financial assistance to patients, because there's not a lot of financial assistance out there.
Didn't you tell me the awful story, and correct me if I'm wrong, some of the people go through all this pain, they have no money, they're out of health insurance, and after that they have to live in their cars.
Some people are living in their cars.
Living in their cars in the good old United States of America.
It's really sad. It's really sad, and it's really scary, and it's even like this dental problem that I have. I mean, I have teeth that I've had to take out because of the treatments that I've had.
Radiation.
But there's no coverage or there's no assistance, financial aid for patients to get their teeth fixed.